Hi everyone, a very good afternoon to all of you. So I hope you guys are all well rested after the examination. So right now we're going to have our recall for the microbiology session. So one thing, salute to you all warriors who have taken this exam. I'm sure the level of questions, the language that was used was much more difficult or confusing. What we usually give you in the recall is just the juice of that topic, like the main essence, like what was asked in the exam, right? So anything, you have to just understand the whole concept of asking the questions, pretty much those things remain constant and the language keeps changing, right? They may introduce some kind of deviations etc in that, and then they will ask you the questions. So either ways, I hope you guys did well. Now this is just a recall that we're doing so that this can help the future batches. All the suggestions are welcome in this. In the comment box you can type, in case even if there are one or two words or some options, if you can recall, right? If there is anything, please help us to compile the questions in a more efficient way. All right, so with this we'll go forward now. So here we go. The first question: a group of students consumed fried rice from the hostel canteen. Following 6 hours later, they started vomiting. Which of the following is the most likely organism implicated in this? Now, a very anticipated type of question, nothing new. See, the whole idea was to pick up some buzzwords from this, and I hope all of you did and marked this correctly. The buzzword here was one, fried rice was mentioned. Second, 6 hour later. We all know the two fast onset poisonings. One is aureus, another is serious. I had told you that basically aureus and serious, they present within 6 hours of consumption of something, but the foods may change. If they mention something like bakery items, dairy products, etc., you should have chosen aureus. But since they mentioned fried rice, it was supposed to be Chinese fried rice. But if they mentioned the Chinese word, I guess it would have been way more easier. So they just gave the word fried rice. So no second option. This is going to be your Bacillus cereus as the correct answer. All right. Now, if you guys notice, in my recent anticipated MCQ series, I had discussed this, food poisoning type of question where I'd asked you about seafood poisoning, where answer was Vibrios. But if you go check in that section, I have told you when to pick which answer. When should you choose aureus? When should you choose serious? When should you choose botulinum, etc.? So that means it is a question that we have predicted, and thankfully God has been kind and this came up in your exam. So the next question goes as follows. A HIV positive patient presented with altered sensorium. CSF sample was collected and India ink staining was performed that turned out to be positive. Which is the organism involved in this patient? Okay, so buzzwords: HIV positive patients. This is one important word right here for us. Second thing, altered sensorium means something to do with brain. And India ink stain was positive. The moment we come to know about India ink stain, it's a very routinely asked MCQ. We all know the answer has to be Cryptococcus neoformans. All right, so this is our correct answer, Cryptococcus neoformans. Once again, doctors, a question from the anticipated series only. You can see I had given a question, identify the organism shown in the image below. See, you have to understand that this picture is nothing but India ink stain picture, Cryptococcus neoformans. It's an example of a yeast. All right. So the next question, a person who was in a long distance relationship presented with painful genital ulcers and tender lymphadenopathy. What is the most likely diagnosis? See, already the long distances hurt. To add more, this also hurts. So what are they trying to tell you? First buzzword, something with STD, painful word is there. I have always told you painful lesions are only two. One is herpes, another is chancroid. Herpes and chancroid. So is there anything that I find from this two in this list? Of course, you can find the word chancroid. All right. So guys, again, I hope you understand the motive of these sessions. I'm not saying the question was only 2 lines or something like this in your exam. I'm sure there was some complicated language. But again, in that you have to find the main thing that the examiner is trying to ask you. All right. So that's the reason we always tell you, look at those anticipated question series. Do the PYQs. The PYQs also tell you like which is the topic that can be again tested. I'm going to give you examples of each one of them with proof so that you understand the importance. When a faculty tells you do this, you should be doing that. All right. So chancroid is the answer. I think you will get bored of me saying this. Here you go once again from the anticipated series. The same painful word I have asked herpes, they have asked, something called chancroid. Although even that is in my options. In fact, I told you how to differentiate whether it is herpes or chancroid if they give you painful word also. Right? Apart from this, other STDs like donovanosis, LGV, syphilis, even their things are mentioned there. All right. So those people who must have watched this series, in fact, I have advised watch this just 2-3 days before exam and go, because these are like very delicate points you can easily recall in the exam. All right, guys. Next, here you go. A 70-year-old male patient, or just a patient, presented with a MRSA that was found to be gram-positive cocci, most common agent that is involved in the prosthetic valve endocarditis. Now, honestly speaking, this question is slightly controversial. The reason being they did not mention the timing, early onset or late onset. They should have done that. They didn't do that. So maybe some of you marked it correct, maybe some of you marked it wrong. It's all right. Exam is bound to have some questions like this. Okay. Now, if you notice the 4 options that are given, all the 4 actually causes endocarditis. All right. But the correct answer to this is going to be staph epidermidis. Okay. As we know, staph epidermidis comes in the class called as cons. Coagulase negative staphylococci, they are the ones who are overall most common in prosthetic valve endocarditis. Okay. So if they would have mentioned early, then answer would have been comfortably epidermidis. If they would have mentioned late, then my answer would have been viridans. All right. But unfortunately, they didn't mention this. Probably that was the confusion that was supposed to be created. But anyway, the correct answer to this is cons. See, again, it's not a new question, right? Same, I made you understand like how the question will be given. They might give you something like a murmur, vegetation, etc. All those in that question. And we have discussed about acute, subacute, etc. Early versus late also we talked. But again, as I told you, unfortunately, they did not mention the timing. That might have confused a lot of us. Now, please don't get this wrong. The thing overall most common I wrote here is not for the, prosthetic valves. I said if they don't mention any of these words like this, they just mention a case of endocarditis, then who should you choose? Aureus. Then the answer would have been Aureus. All right. So that's about it. This is another question straight out of the anticipated series. Again, for the future exams, please watch this recall sessions also, because even from here, some MCQs would come in the future exams. Now, here we go. Next question for us. A patient tested SBS antigen positive. IgM anti-HBC is positive. What is the status of the condition the patient is affected from? Okay. So we are talking about hepatitis B, as you can see right now. So they're just asking us what is the status of this patient. So doctors, let's try and understand this. HBs antigen staying positive, that means you're having hepatitis B. IgM anti-HBC. IgM antibody itself tells me acute. So since acute word I got from this and HBS, let's check is there any option like that. I hope you're all able to see A, B, C, D. The first option is none other than this. It is acute hepatitis B infection. Acute hepatitis B infection. All right. So that's about it. Nothing fancy in this. Two questions were asked on this. In one of them, they gave the markers and they asked you what is the situation. That was told by the students. And in the second one, they gave a situation and they asked the markers. So if you check in this, what are the markers, etc. Let's figure this out. A patient sample is positive for infectious hepatitis B. Okay, so they're saying infectious hepatitis B. Which of the following markers would be positive? So when we learned about the hepatitis B, I've always told you infectious means use the mnemonic E for infectious. E for infectious, and remember the antigen is HBe antigen. So from this list, it is HBs antigen plus HBe antigen. Maybe there is a slight change in the options, etc. But the theme of the question was this, right? So HBs antigen tells you the person is having hepatitis B, and HBe antigen tells you the person is infectious. Okay. Again, there you go. Something from my anticipated question series. Straight away you can see the markers and that question, and I've explained to you in all the details how to answer this MCQs routinely asked. All right, so until now I'm sure you can say that these are things I told you will come. Anticipated series mein, if you're seeing all these things and they're coming, that means it should not be a surprise factor, at least for people who have watched my series. Now, next question is this. What is the mechanism of action of botulinum toxin? Let it be my pharma class, let it be my micro class. I'm sure you guys all know this. Botulinum toxin, what we call as Botox, basically it blocks the release of acetylcholine. We all know acetylcholine is actually supposed to do what? Contract my muscles. But if you block acetylcholine, what will happen is the muscles would relax. The muscles would relax. And that's why the drug called Botox is used in the treatment of some kind of a contraction. Since it relaxes muscle, it would be used in some kind of a contraction. So that's it. Let's find that option. Here you go. It inhibits the release of acetylcholine. Now, if you look, here we go once again. Another question from the same anticipated series. It's like literally almost every question from my series have pretty much showed up in this exam. Mechanism of action of diphtheria toxin, that's the one I asked. And if you notice in that, the 4 type of toxins they usually question in exam, I have discussed about all of them. Neurotoxins, botulinum as well as tetany, both of them are discussed over there. Okay, so please do watch that series even for the future exams. That's going to be definitely helpful. I think this should give you an idea, like when we say some things are important, see, we are not gods, we cannot predict things, but we can just guess based on what the examiner may ask. Based on our experience, we are just doing that, right? I'm not special, I'm not anything, I'm just saying that based on our experience we share the things. That's my job, right? This is my job to help you guys, and I hope this helps you. Next question, my friend. A sample taken from a vesicle was prepared on zinc smear, shows the multinucleated giant cell. Which is the most likely agent? Okay, so zinc smear, not a new question, it's a repeat question again. So you must know zinc smear is done for herpes simplex viruses, or simply the first 3 viruses of herpes, namely HSV1, HSV1, HSV2, and HHV3, that is varicella zoster. So what is this multinucleated giant cells? They are nothing but the macrophages that have fused together. They end up looking like one big cell called as giant cell, right? So this is the correct answer for this. Now, just recently discussed, if you can check, that's why I told you watch the recalls of both, NEET-PG as well as FMG. Right here you can see, we had discussed about this, Zank smear, etc. So again, a repeat MCQ. A newborn presented with sensory neural hearing loss, salt and pepper retinopathy, what is the most likely diagnosis? Okay, the correct answer to this is going to be rubella. I have told you that the term called Bella actually means beautiful lady. The word Bella means beautiful lady. And I told you the way to remember this is she is a beautiful lady. And when we get somebody very beautiful in our life, we tend to become blind and deaf. We forget people, etc. So blind and deaf in the love of Bella. Blind and deaf in the love of Bella. What is this love sign I've put? A heart disease called as PDA, patent ductus arteriosus. The blindness is happening due to cataracts or the salt and pepper retinopathy. The deafness is the sensory neural hearing loss. So this combination you all got to know. In fact, another important MCQ that they can ask you here is the treatment part. The treatment is the drugs that we use. One is ibuprofen. This will be the best medicine we can use. Another one is indomethacin as well that we can use. The drugs called NSAIDs are used to close the ductus. All right. Next question. A child presented with hydrocephalus and diffuse cerebral calcifications. Which of the following is the most likely agent that is involved? Okay, so when you see the word diffuse cerebral calcification, I think this is a giveaway that this is none other than toxoplasma. The correct answer here, it is going to be toxoplasma. So is this a new question for us? Not really. Once again, if you notice in this just PYQs, you're seeing this, the exact pretty much question we had discussed there. And I in fact told you if they give you calcifications in the brain, you should be knowing one is toxoplasma, another is CMV also. But the difference would be if they mention diffuse calcifications, cerebral calcification, it is toxo. But if they mention periventricular calcifications, then the answer will be CMV. Answer will be CMV. Okay. And one more thing you must keep in mind from this is RNC, that is rubella, and CMV, they're both associated with something called as blueberry muffin syndrome. Right? This can be asked in future. Blueberry muffin, it is seen with rubella and with CMV. All right. A farmer presented with jaundice and subconjunctival hemorrhages. Microscopic agglutination test was performed that turned out to be positive. Which is the most likely agent involved? All right. So buzzwords for tomorrow, it can be jaundice and subconjunctival hemorrhages. Even calf tenderness is one important feature that you can see. If you have diagnosed this disease by now, they're talking about leptospirosis. Okay, leptospirosis. Now, from the clinical features also we can memorize and keep this in our head, and this would be the answer. And another hint they gave is the name of the test, that is microscopic agglutination test called as MAT. Here you guys. If you check this out, another question pretty much same, discussed, already done and dusted. Leptospirosis mat is the test. So I gave you one mnemonic, cat sat on mat, may be later, where may stand for Mycoplasma, Brucella, Leptospira. I felt so happy. In fact, when the students after exam were, texting me, sir, your mnemonic came cat sat on mat, I was like, one question dusted. Okay. More than you guys, we are also writing the exam, right? It's a responsibility of so many students on our shoulders. So we also feel happy when you guys do well, right? It's a mutual, symbiosis that exists between us. So done about this question. Treatment of cryptococcosis. Treatment of cryptococcosis. Now, this is the antimicrobial section, obviously something from pharmacology, but we also tend to teach you in micro. That's why I'm taking this question. If you don't want to consider this micro, go ahead. Doesn't matter, right? I'm here just to discuss some things that we teach in my classes. That's it. So, treatment of cryptococcosis. It is a combination of two drugs, basically flucytosine plus amphotericin B. Amphotericin B, this is a combination of two drugs. Okay, there is an induction therapy, meaning we start the treatment with this. Later, we may switch to fluconazole. So, fluconazole is used even for Candida as well as Cryptococcus. But for meningitis treatment, we have to use flucytosine plus amphotericin B. So most likely, I think they've given cryptococcal meningitis. So what is the treatment? The answer is flucytosine plus amphotericin B. Okay. So just for a sample, now the app that I have with Medway here, this is just a screenshot of the notes from this. All right. So this is the fungus topic notes, as you're able to see. Most likely the topic called Cryptococcus and pneumocystis, those guys that happen when the CD4 count falls below 200. So this is where we talked about meningitis, the India ink stain, and the treatment also. You can see meningitis treatment is flucytosine plus amphotericin B. Okay, so that's it. Many of you were asking me about the app of microbiology. When is it coming? It is already launched. Now there are some sections that are going to be still recorded, and I'm going to launch this app soon enough completely. All right, next one. A firefighter presented with fever and cough. Microbiological testing showed gram-negative oxidase-positive organisms. The growth in the culture is shown in the image, and the colonies transluminate on passing light. Which is the most likely agent? Guys, there are three hints that are given in this question. One is firefighter. Firefighter means he might be more prone to burns. Okay. Now, burn patients get infections like Pseudomonas. This is something you got to know. Now they mention gram negative and oxidase positive. All right. Since gram negative is mentioned, it cannot be aureus. Although aureus also can be there in burns, but Pseudomonas is the most common organism. Gram negative and oxidase positive confirms it is Pseudomonas pretty much. Now, if you look, we learnt in the Pseudomonas culture media, this is the organism that produces pigments. Pyorubin, pyocyanin, etc. It is producing pigments, and pigments give certain colors. So I was told that they gave a picture of the culture media, and I hope this was pretty much the type of picture that you must have seen. So the correct answer is gonna be none other than our Pseudomonas in this picture. All right. So I hope most of you must have got this correct. Some students were telling me, sir, we were thinking it is somebody called as TCBS. TCBS is Vibrio cholera, but you see in the picture that was given, meaning the clinical picture, etc., it is nothing to do with cholera. Okay, so it cannot be the TCBS. Next question. A person had a thorn prick. Few days later, a lesion appeared that started to spread along the lymphatics. Which of the following is the most likely organism? All right, a very common thing, I believe most of you must have caught this. It is Rose Gardner's disease, which is caused by an agent called Sporotrichosis. Okay, so this is the correct answer. Sporotrichosis, it causes Rose Gardner's disease. All right, guys, it is a only dimorphic fungus that causes a subcutaneous infection. Now, in one of my other important question series, you can see just this MCQ right here, the ulcers along the line of lymphatics, etc. This question I've already asked you. Okay. A patient who presented with intense cough got diagnosed with TB. Which is the selective media used in the isolation? A very easy question, in fact, I would say. See, TB, you should be knowing inside out. There will be questions coming from both micro as well as pharma aspects. So this time you can say 3 questions came from TB. This is the selective media that they have asked. LJ media, right? I told you this is the culture media on which you can see the rough, tough, buff colonies of Mycobacterium TB. Other cultures, TCBS is for cholera, PTA is for diphtheria, and Thea-Martin is for Neisseria, gonorrhea, or even for meningitis. Nothing surprising. Again, in this question, we have discussed about the different culture media where which guy is used. And in the options, I had given only those important type of culture medias which are routinely asked. Okay. What is the management of HIV positive patient with multiple dog bites with punctured wounds, right? Punctured wounds. So you must know, like in rabies management, there are 3 categories. Category 1 is no risk of rabies, so no treatment is done. Category 2 is mild to moderate risk of rabies, so we give vaccine plus we do something called local treatment. And third one is category 3, which is high risk of rabies. Bites with bleeding, licks on abrasion, these are all considered to be high risk of rabies. In the category 2, we do 2 things. In category 3, we do 3 things. So right here, local treatment, meaning cleaning the wound properly, plus vaccine, plus ready-made antibodies, that is human rabies immunoglobulin, must be administered to this patient. Okay, it's not a new question again. This was from one of the PYQs. Once again, I am showing you that. Like this was a question that was already asked. Okay. Next, a patient presented with fever and nuchal rigidity. Lumbar puncture was performed and the CSF analysis reveals low glucose and increased neutrophils. What is the most appropriate treatment? Now, maybe the options are not exactly correct, etc. But the theme of the story, which most of the students told me, was, sir, they have asked about bacterial meningitis and its medicine. Now, you must know that usually when there is bacterial meningitis, we use broad spectrum antibiotics, especially 3rd generation cephalosporins, because they cross blood-brain barrier. Okay, if you see the example, ceftriaxone has the word tri for 3. That is, it's a 3rd generation cephalosporin. It crosses blood-brain barrier. So most likely you can use this drug. And if you expect some other organisms, then we may add them in the ceftriaxone. Meaning, apart from ceftriaxone, if you're expecting listeria, then you may add ampicillin. If you're expecting MRSA, then you may add vancomycin. Or the best drug for Neisseria meningitidis or meningococcus, it is penicillin G. So these are all the drugs we actually use in meningitis cases. So that's what I have put in the options. just for the future reference. Maybe if something else is asked, you should be knowing from here. Okay. So again, first we need to diagnose. We needed to diagnose that it's bacterial meningitis, whereas taught you how to diagnose whether it's bacterial, viral, or TB meningitis in one of this MCQs. So just remember, anytime the glucose is less, it is bacterial. Plus, if you see neutrophils, it's simply called bacterial meningitis or pyogenic meningitis. Okay. So next question is, resistance to which of the following ATT drugs is associated with CAT-G gene mutation? Okay, CAT-G gene mutation. So what is the story of this? Basically, the drug called as INI-CET, it gets into its active form. By using one enzyme called as catalase. Okay, catalase is the enzyme that is required to basically convert a drug called INI-CET, which is a prodrug. Prodrug means inactive drugs, you all know from pharmacology. So INI-CET converts to its activated form by using one enzyme called as catalase. Let's underline the word cat. Cat means the gene that is required for this enzyme to be there is catalase. So now understand, if the organism is mutating this gene, then the catalase will not be available. If catalase is not available, then INI-CET will not be active. And that's what will lead to your drug resistant TB. Like, as you know, MDR-TB means INI-CET and rifampicin does not work. So there are main two genes you should be knowing from TB. One is CAT-G gene for INI-CET and the RPO-B gene for rifampicin. Okay, so that's it. This should be the correct answer for this one. I've always told you, even during my pharmacology lectures, that TB, malaria, HIV, from this three specific chemo, questions will come. And there you go, another MCQ. A patient was started on ATT and ART, most likely together. 2 months later, experiences fever and respiratory distress. Okay, some symptoms were given, that's what students told me. What is the most likely reason? So guys, 4 options that you can see here, but the correct answer in this would be immunological reaction. This is the correct answer from this. So those who have attended the regular classes of mine, it's written, the last line in our TB treatment, it is this only. So if you're dealing with a case of HIV and TB together, see, first of all, you all should know the most common infection in HIV infected patients will be TB. So HIV and TB are very strongly associated. So you must know something about their treatment. You should first always start the treatment of TB. ATT should be always started first, followed by the ART later. And there should be at least a gap of 2 weeks in between. Now, why this gap has to be there, etc., you must keep in mind, this is kept basically to prevent something. There is a thing what we call by the name of iris. Okay, so there is a immunological reaction. If you don't do this, there is a thing by the name of iris. Now, to prevent this only, we are actually doing those things. Now, what is this iris, etc.? Let's try to understand the basics. See, assume you started HIV treatment and TB treatment together. Okay, HIV treatment and TB treatment together. What could end up happening? This is what is important for us. What could end up happening is the thing called iris. So what is happening? Here we go. When you give ART, meaning retroviral treatment, to somebody, it leads to improvement in your CD4 count, meaning your immunity is becoming better, right? So if you start the HIV treatment like that, what is happening is your immunity is getting better, and this immunity gets overexcited and tries to kill the TB that is found. So if you start TB and HIV treatment together, still TB is there in the body. So what is happening is the immunity is getting too much excited, and this will go and harm the TB. While trying to harm the TB, it damages you also. So that's why we don't want this to happen. That's why what we do, first we will start the TB treatment, kill the TB as much as possible. So imagine now you have killed the TB. In the lungs, you don't have much TB. You don't have much TB in the lungs. Now, even if you give HIV treatment, let's say CD4 count improves also, they don't have much TB to fight, and that's why it will not cause that immune reaction. So as I told you, there is this thing by the name of iris. So this question, it's nothing but a thing we call by the name of iris. So what is iris? Immune reconstitution. Immune reconstitution. As I told you, means it's coming back again. Immune reconstitution. Inflammatory syndrome. Inflammatory syndrome. This is what is simply known by the name of iris. All right, dosto. Now, since we are done with this, next question you can see now. Which of the following is incorrect dose in the leprosy treatment? Okay, in the leprosy treatment, which is the incorrect dose? Okay. The correct answer to this is rifampicin 450 mg. Okay. Now let's go here. Again, in the main classes of microbiology, I had given you this kit. I told you there is an update that has come in the treatment of leprosy. The kits have been revised. In fact, I told you that this is a hand drawn. I had drawn this kit for you so that in case it comes in exam, we should be ready. And it happened. Even in my anticipated questions, this time I put a question on leprosy only. I explained this, but again, I did not expect they may go up till the dose also, but they did. So again, if you see our main notes, it's there, this kit. So if you notice, none of the doses in this is 450. That means that is wrong. Even if you had given one glance to this picture, okay, you may remember there is no 450 or anything. It's only 150 and 300 in this. So how this will be actually given? Look at the kit. Excuse me. So if you look at this kit, my friends, you can figure out day one what is done is there is one drug given, that is dapsone. One pill, 100 mg will be there. Next, rifampicin 300 mg into 2. That means you can see this is rifampacin's 2 pills. 300 into 2 means total it becomes 600 mg rifampicin is given once a month. Okay, monthly this is given. And if you notice the C, clofazimine is 3 tablets on the top. This is 100 mg into 3, that is total it becomes 300 mg monthly. So if you check this out, the first part of this is the one that we give monthly, doctors. Okay, clofazimine is given 300 mg monthly and 600 mg rifampicin. And what about day 2 onwards, meaning this remaining kit? If you notice, this remaining kit will have only 2 drugs. One is dapsone, that is one drug, and the clofazimine. Dapsone and the clofazimine, those are 100 mg and the 50 mg. Okay, slightly definitely on the difficult side because doses etc we may not be much acquainted, but again this was anticipated. It's not like something that came out of the blue. This anticipated question series also I have put leprosy, and in my recent notes all of you know this is the picture that is there. Okay, Next question. I don't know the exact wordings of this, like I could not get this, but students were telling me something on the cell wall also that they have actually asked. So anything, if you may know from this, please do share with me, my friends. Like cell wall is tough because of the presence of what? This is what they might have given. All right. So cell wall is tough because of the presence of the substance, what the cell wall is made up of. Okay. And that is nothing but peptidoglycan. See, peptidoglycan is present in positive and negative. It may be thick or thin, but it is present in both. But other things, if they gave this in the options, then they cannot be true, because teichoic acid is present only in the positive bacteria. LPS and outer membrane are present only in the gram negative bacteria. So again, I'm not very sure about this, like how this question etc was asked. Okay, so I'll just choose this as the answer. Again, I'm telling you, this might be a wrong framing of the question etc. Please try to help. You may actually put this in that. So cell wall is rigid or tough or whatever, some question they gave like this. That is most likely peptidoglycan must have been the option. Okay, doctors. Next, these are questions I could not get my hands properly on, because I believe, especially Vidal test question, it was not asked about just the basic like blood culture, Vidal test, etc. They might have given some values, I believe, and based on that, some question was asked. So again, some questions we can expect, my friends, that are going to be, on the difficult side, or they don't want us to answer also. It may be one of that. And honestly speaking, I don't understand the malaria and antigen correlation. Maybe just a deviation they put there, over in that question. You can check, was there a question on heterophile antigen as well? Maybe. There were at least 3 to 4 students who told me, sir, some sex worker story they made up, and they asked a culture media, and Thayer Martin media was the answer as per the students. And they also told me Shigella hemolytic uremic syndrome was also asked in this. So if that was asked, then please try to put up those some words also, any option or anything if you remember, so that I can frame those questions and definitely they can be helpful in the future. Okay, so pretty much that's about it. These are all the questions. As you can see, like majority of the questions in this, they were either from the anticipated series or more or less from the PYQ sessions, etc. So hopefully you guys rocked at least in the microbiology section, because the paper 1 was supposed to be difficult as per most of the students reviews. They told me that paper 1 was this time difficult, sir. So it happens. Sometime paper 1 is difficult, sometime paper 2 is difficult, whatever it is. So micro section at least was fairly doable from what I feel. Again, I may have a bias because I'm a faculty, but sir, students also, majority, they told me, yes sir, many things in the paper 1 we could not, but micro was like very doable. In fact, that was the lifesaver in the paper 1. Hopefully your opinion is also like that. Okay, remaining, follow on the Instagram, etc. Stay in touch, because all this kind of videos, etc., whatever I do, I upload the links over there so that you guys can follow and watch them. Every day MCQs are being posted, etc. All those things are there. And remaining, now just is the time to chill. Pretty much you're sorted. Wishing you all the very best. Hopefully I get to hear the good news from all of you. I'm waiting that, yes, you guys cleared this exam. Praying for all of you. Okay, so take care, everybody. That was the small session that I wanted to do. Hopefully this compilation of the questions will help the future batches also to revise things in a more efficient manner. but yes, the exam level is definitely increasing. They're increasing more of integrated questions, etc. So definitely we need to upscale as well as per the exam. Okay, so thank you very much everyone, those who had joined in. Remaining, take care. I'll hopefully get to hear the messages from you. Take care. Bye bye everyone.